TB is the most neglected disease, but yet it kills more people. It passes HIV, but still there's no much work being done with TB, no new tablets being made. So people are dying every day.
TB is a huge problem in South African healthcare at the moment. We have massive public health implications of managing TB and HIV, and the two epidemics have had a huge bearing on one another. R&D is so critical, absolutely essential in this context. Having worked in TB myself and seen the evolution of the epidemic, it's so important that we stay one step ahead, so to speak.
Well, anyone can get TB, doesn't matter who you are or where you're from. I might have caught it on a bus, I might have caught it on campus, I don't know where I caught it.
I had been treating outpatients with TB. My first bout with illness was in 1995 when I developed a pneumonia and was very ill with that, and took a bit of time to get better. And it was only some time after I left that work and referred myself to a colleague for a bronchoscopy that my TB was confirmed.
I was given normal TB drugs. I took for about 3-4 weeks. I was not responding. Then they told me that it is not normal TB, it is MDR TB.
Multi-drug resistant TB, or MDR TB. And the definition of that is a strain of TB which is resistant to 2 of the most important first-line drugs. Subsequent to that, the epidemic included XDR TB, extremely drug-resistant TB, or even a new form which is developing now, which is called totally drug-resistant tuberculosis.
On the normal TB treatment, there were like 3 tablets, which small 6 ones, which it was easier to take. When they told me that I wasn't responding to that treatment, I was given 20 tablets a day with an injection. Those tablets make you sick. You vomit after drinking those tablets. They make your skin dark. And then 4 months later, from the injection, I got deaf. I woke up and then I was deaf. No one explained anything about the side effect of the drug.
Now, having TB myself certainly was a life-changing experience. It's difficult to take a long course of treatment. I think it's perhaps only when I took it myself that I realized the impact it has on our patients.
You take the tablets, you get sick, then you already are. It doesn't make sense, right? So just imagine going on all of that every day for 2 years. That's why most people stop taking their tablets, because this is just too much. You're already sick, but then the tablet's already making you sick. That is just too much.
So there is a huge need for well-tolerated medication, and there's a huge need for effective medication. If the courses could be shorter and better tolerated by patients, we would expect to get better results.
So I think and I believe that research and development must be done. People who have TB must be involved in those things so that they'll know what people with TB go through. Like, for instance, the side effects of the drug. I don't think anyone can just wake up now and then tomorrow morning they are blind or they are deaf. That is just life-destroying, and people can't continue with their lives. So I think having 1 tablet a day will just help many people. And we need people who are committed to eradicating TB and also helping out with TB medication.
It was only after the MDR strains started being developed that there was a huge push in terms of research, and additional drugs were developed. So research and development needs to be timeous. This is so important that we keep a step ahead of the game, if I can say that. Because if you research and innovate and actually prevent this progressive change into this more resistant form, or limit infection at source, or prevent people from getting TB before they actually become infected latently, those long-term benefits would eventually translate. So the role of research and development cannot be overemphasized. It's absolutely vital.